Can you delay Medicare Part D with credible employer coverage? Imagine being able to hold off on signing up for Medicare Part D and still keep your prescription drug coverage intact. That might sound too good to be true, but it is possible under certain conditions. If you're working past age 65 and have employer-sponsored drug coverage that meets specific standards, you can delay enrolling in Medicare Part D without facing penalties. This is because your employer's plan can be considered creditable coverage, meaning it pays at least as much as Medicare's standard prescription drug plan would. When your employer's coverage is creditable, you don't have to enroll in Medicare Part D immediately. You can keep your employer plan and avoid late enrollment penalties as long as your coverage remains creditable. Your employer is required to notify you each year about whether their drug plan is creditable. This notice is usually sent during open enrollment or when you first become eligible for coverage. It's important to keep track of these notices so you know when your coverage might no longer be creditable. If your employer's plan stops being creditable or you lose your coverage altogether, you should enroll in Medicare Part D as soon as possible. Waiting too long after losing creditable coverage can result in a late enrollment penalty. This penalty is calculated as 10% of the national base premium for Medicare Part D for each month you went without creditable coverage after your initial enrollment period. If you go more than 63 days without creditable coverage, you will be charged this penalty when you finally sign up. There is a special enrollment period you can use once your employer coverage ends or becomes non-creditable. This allows you to enroll in Medicare Part D without penalty. The period begins the month after your employer coverage stops and lasts for up to 63 days. During this time, you can sign up for Part D and avoid penalties. For those working past 65 with employer coverage, the key is to stay aware of your coverage status. Continue your employer's creditable drug coverage while working. Keep track of the notices your employer sends you about your coverage. When your employer coverage ends or is no longer creditable, plan to enroll in Medicare Part D during the special enrollment period. This way, you can maintain continuous drug coverage and avoid unnecessary penalties. In short, if your employer's prescription drug plan is creditable, you can delay Medicare Part D enrollment without penalty. Just remember to monitor your coverage status closely and enroll promptly when your employer coverage ends or becomes non-creditable. That's the best way to keep your prescription drugs covered without extra costs.